Hello friends, I am Dr. Abid. Today I'm going to discuss with you vertigo and how it is different from dizziness. Vertigo and dizziness are a little similar but still different. Vertigo is present when you feel that the things in front of you are moving, or you feel as if you or the things around you are rotating. Vertigo and accompanied by nausea and vomiting and nystagmus. Nystagmus is the jerky movements of eye. You can feel it if you see things moving right to left and back again repeatedly when seeing straight. Dizziness in comparison is a little vague term which is used by different people differently. Some describe lightheadedness as dizziness, some describe imbalance as dizziness, still some say that they have dizziness while they actually have feelings of fainting. In this video I'm going to discuss with you only vertigo. Note that vertigo starting suddenly is usually of benign nature, while if it starts insidiously it can point to some serious problem such as some lesion in the brain. Perhaps the most common cause of vertigo is benign positioning vertigo. Onset is often abrupt, often awakening the patient from sleep. In this condition, patient usually feels vertigo for a few seconds when he lies down on the bed or sits up from lying. Sometimes it occurs when patient changes position in bed while lying down. It also occurs when reaching upward for an object placed on a high shelf while standing on a ladder. Sometimes vertigo is longer and more sustained. Dizziness that worsens with moving from lying down or sitting to standing also occurs in chronic fatigue syndrome, but excessive fatigue after minimal physical or mental exertion, muscular aches, sleep disturbance and poor concentration differentiate it from benign positioning vertigo. Symptomatic treatment of all types of vertigo is some vestibular sedative. Vestibule is the part of inner ear. In my experience, combination of two drugs named prochlorperazine and beta-histine is best. Benign positioning vertigo is usually self-limiting and disappear after weeks or few months. If it doesn't, then specific treatment is needed, which is physiotherapy. So if you think you have benign positioning vertigo, then ask your doctor to refer you to physiotherapist. The cause of more persistent but still intermittent vertigo is Meniere's disease, in which patient has episodes of vertigo accompanied by ringing in ears, fullness in the ear and deafness. Each attack usually lasts a few hours. Management includes a low-salt diet, water pills, vestibular sedatives for acute attacks and occasionally surgery to increase endolymphatic drainage from the vestibular system. The U.S. Food and Drug Administration recently approved a device for Meniere's disease that fits into the outer ear and delivers intermittent air pressure pulses to the middle ear. The air pressure pulses act on endolymph fluid to somehow prevent dizziness. This is called pressure pulse treatment. Third cause of vertigo is acute vestibular failure, also called labyrinthitis or vestibular neuronitis. It usually presents as isolated severe vertigo with vomiting and unsteadiness. Onset is abrupt, often on waking, and many patients are initially bedbound. The vertigo usually settles within a few days, though head movement may continue to provoke transient symptoms for some time. Sometimes symptoms linger on, patients complaining of ongoing imbalance and disequilibrium rather than vertigo. Physiotherapy can help here too. Other less common causes of vertigo include certain medications, including some antibiotics, anti-inflammatory drugs, arrhythmia and diabetes. The causes I have discussed so far are the peripheral causes of vertigo. Central causes of vertigo are the causes when there is some problem in the brain such as stroke, head injuries, multiple sclerosis and infections of brain. Now I will discuss how to differentiate central causes from peripheral causes. Central causes of vertigo do not cause ringing in the ears and other neurological symptoms, but peripheral causes can cause ringing in ears or neurological symptoms. Peripheral causes usually cause severe vertigo while central causes produce mild vertigo. If you find this video informative, please subscribe to my channel.